Medicine Hepar Sulphur in Glycosuria. The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your family doctor before using any medicine. Self-treatment may always be injurious. पेशाब में शुगर आना, ग्लाइकोसूरिया, डायबिटीज की बीमारी कभी ठीक नहीं होती, ऐसा विश्वास किया जाता है, किंतु यह सत्य नहीं है। यदि आपको ग्लाइकोसूरिया है, पेशाब में शुगर आ रही है, जहां आप पेशाब करते हैं वहां छींटे लग जाते हैं और यहां बताए गए लक्षण आपको हैं, तो आपके लिए हीपर सल्फ उपयुक्त दवा है। दवा का पूरा नाम हीपर सल्फ्यूरिस कैल्केरिया या हीपर सल्फ्यूरिस कैल्केरियम है। आइए जानें कि ग्लाइकोसूरिया नामक बीमारी में दवा हीपर सल्फ कब उपयोगी है। The slightest contradiction makes him break out into the greatest violence. He could kill somebody without hesitation. Sight gets dim when reading. Heaviness and pressure in the stomach after a moderate meal. Unusual hunger with thirst. Desire for acids and wine. Sexual desire increased. Erections feeble. Urine acrid, burning, making the inner surface of the prepuce or of the pudenda sore and ulcerated. Emission of much pale urine with pressure on the bladder. Emission of pale clear urine which on standing becomes turbid, thick and deposits a white sediment. आइए जानें मेडिसिन हीपर सल्फ के कुछ अन्य महत्वपूर्ण लक्षण। The characteristic of हीपर is oversensitiveness. Oversensitiveness runs throughout the remedy. Any trouble occurring on the skin where there is a great sensitiveness to the slightest touch, patient can't bear to have even clothes touch the part or have it touched in any way. Exanthema, like needle rash, sore to the slightest touch, skin hard to heal, inflammation of skin, sensitive soreness of skin, but the sensitiveness is not confined to touch. There is excessive sensitiveness to the air. Patient can't bear the least draught, and if a hand accidentally gets outside the blood cloths, it brings on an aggravation. Sensitiveness to noise, to odors. Dissatisfaction with oneself and others. Dreamy, a troublous mood. A sort of ferocious spleen as though one could murder a man in cold blood, even in persons who are generally of a merry and benevolent disposition. Irritable and angry, feels inclined to kill anyone who offends him. The slightest pain causes fainting. There is also irritable heart. The sensitiveness to cold air is more to the dry cold air of aconite and bryonia. This distinguishes it from natrum sulph in asthma, which has aggravation from damp cold. Hepar croup is accompanied with rather loose cough with wheezing and rattling. Cough as if mucus would come up, but it does not. The time of the Hepar croup is early morning, aconite in evening. The least breath of cold air aggravates the cough on any uncovering. Sensation of a splinter or fishbone in the throat. In quinsy with throbbing pain where suppuration is imminent, Hepar is indicated. Throbbing, stabbing pains with general rigor. Kali Sulphur acts on the epidermis, Hepar on lymphatic glandular system, skin and respiratory mucous membrane. Calcarea Sulphur acts much as Hepar, only more deeply. Hepar acts on abscesses before they open, Calcarea Sulphur after. Calcarea Sulphur is suited to quinsy after it breaks, Hepar before. Silicea and murk are inimical, but if Hepar is given as an intermediary, no unpleasant effects will occur. It follows mercury. When this ceases to help or has aggravated in rheumatism, quinsy, boils and suppurations, sweats day and night without relief, Hepar has sensitiveness to chill and liability to take cold from every exposure. Coryza, nose swollen and sore to the touch, especially inside the alley. Boring at root of nose with catarrhal symptoms or headache is characteristic. Croup inflammations of throat, respiratory organs, bowels and kidneys, the inner as well as the outer skin. In fact, the ulceration of the skin is peculiar. Ulcers with bloody pus, with sour smelling pus, stinking pus, putrid ulcers with redness around, with little pimples around, 10, 12 or even as many as 50 may surround the large ulcer, and the ulcer sometimes spreads by little pimples joining in. Painful at the edge, suppurating with pain as if sore, difficult to heal, inflamed, itching, looking like a lump of lard with a hole in it, cancerous ulcers, smelling like old cheese. The itching in connection with jaundice. In the respiratory organs there are suffocative attacks of breathing. In croup the child chokes in its coughing spells and there is much rattling. Respiration with mucus rattle. Expectoration in the morning, none in the evening. Cough with expectoration during the day, none in the night. In croup, no expectoration at night but only in the daytime with the suffocating coughing spells. Low, weak voice. There is a semi-paralytic condition of the rectum and bladder somewhat like that of alumina. The stools are passed with great difficulty even when clay-like and soft. Fetid stools with a sour body smell in children, sour stools in diarrhea, desire for acid things. Micturition is impeded, obliged to wait a while before the urine passes and then it flows slowly. Never able to finish urinating, it seems as if some urine always remains behind in bladder. Urine drops vertically down. The urine is very acrid. There are complaints during micturition and after. Nocturnal emissions. Escape of prostatic fluid at any time and at stool. Affections of the sexual organs occurring on the right side. It is suited to the psoric scapularis diathesis. Debilitated subjects, great tendency to suppuration, strumous, outrageously cross children, torpid lymphatic constitutions, persons with light hair and complexion, slow to act, muscles soft and flabby, slow torpid constitutions with lax fiber and light hair, great sensitiveness to slightest contact of ulcers, eruptions and parts affected, These conditions differ from the sulfur type, lean, stoop-shouldered, unclean-looking, aversion to warmth. The symptoms are worse in the night, worse on awakening, worse when blowing the nose, worse from cold in general, worse in cold dry weather, worse on single parts of the body getting cold, worse from getting the skin rubbed off, worse on uncovering the head, worse from surgical injuries in general, worse from lying on the painful side, worse from daylight, worse from pressure from without, worse from abuse of mercury, worse during sleep, worse when swallowing, particularly when swallowing food, parts are so tender, worse while urinating, worse in clear fine weather, worse in dry weather, worse in the least wind. Symptoms are better from wrapping up the head, better from warmth in general, better the air being warm, better in damp and wet weather, better from wrapping up the body warmly, better by eating. A comfortable feeling after eating is very characteristic. There is a marked periodicity in Hepar. Every day, every 4 weeks, attacks of paralysis. Every 4 months, scabby eruptions on head. Every winter, wheat loss. Spring and autumn, bilious attacks. The bends of the elbows and popliteal spaces are affected by Hepar. In eye affections, patient likes to have them covered lightly. Pustular ophthalmia of left eye, better keeping eye closely covered with some soft fabric. Worse mornings, better as day advanced. Pimples surround the affected eye.